This is our lesson 20. Here we will discuss the hypertrophy versus enlargement of the cardiac chamber. Now, hypertrophy means increase in the muscle mass. Hence, the wall, when it is hypertrophied, it is thick and powerful. It is due to the pressure overload, and where the heart has to pump against increased resistance, and blood is ejected against increased pressure. For example, increased resistance. For example, hypertension. When there is high blood pressure, the resistance of blood flow is high in the aorta and arteries, so the blood pressure becomes raised. So this resistance will cause hypertrophy of the left ventricle, and also similarly can be seen in aortic stenosis when the valve of the aortic valve is narrowing of the aortic valve. This will also cause increased resistance in the flow of blood from left ventricle to the aorta. So, the nutshell, hypertrophy, the muscle mass is more and it is powerful, and it is seen because of pressure overload pressure in the aorta. So, the blood has to be pumped against pressure. In case of eyes, for example, in hypertension and in aortic stenosis. While in enlargement means dilatation, that is expansion of the particular chamber. It is caused by volume overload. What is volume overload? That is the blood coming to the atrium through superior vena cava, inferior vena cava in the right side, and through the pulmonary vein in the pulmonary vein to the left atrium. So the blood flow is coming to the atrium through these vessels. Now if the amount of blood coming into the atrium is more, and this will cause, and the EkG is not, this will cause expansion or dilatation of the chamber. So what do we mean by enlargement of the atrium? Hypertrophy of the ventricle and enlargement of the atrium is because of the volume overload. More blood is coming into the atrium, and atrial wall is thin. Then this will push towards the wall, and this will get dilated. So volume overload will cause dilatation of the atrium, that will result in enlargement of the atrial cavity. Now, reason. What is the reason of hypertrophy and enlargement? EkG is not very good to differentiate between the hypertrophy and enlargement, but it is by tradition we call atrial enlargement and ventricular hypertrophy. It may be remembered that the hypertrophy and enlargement of the chamber can be coexisting. Now, in this diagram, what is shown here is the right atrial enlargement. Blood is coming more in the right atrium, so this blood will push the atrial wall, and atrial wall is thin and its electrical current is going downwards. So it will be recording a dilatation effect of more volume of blood which is pushing the atrial wall, and this will cause expansion or dilatation or enlargement. While when we talk of ventricle, left ventricular wall is thick. Why it is thick? Because in the aorta, blood has to go to the aorta, and the aorta has got a diastolic blood pressure of 80, systolic blood pressure of 120. So there is increased pressure. The blood has to push out through aorta or pulmonary or into the pulmonary trunk with increased pressure. So this is pressure overload, which will cause enlargement of the ventricular wall, and this will result in the ventricular hypertrophy. So enlargement of the atrium is because of the volume overload. Volume is more, and this overload is causing expansion of the wall, while pressure overload in the ventricle will cause hypertrophy. So that is the difference between hypertrophy and dilatation.